So it's preparing to live stream. All right, so it does look like we are live. Hello, everyone. Good morning. Happy Sunday, everyone, and happy pre-spring for anyone living in the Chicago area where it's been, well, warmer than usual. So I am here today with Holly Gans from Animal Biome, and she has done a lot of research or is working on it to find out more about the oral microbiome. So we're going to dive in, but Holly is a fellow bug lover. So we both have a love for bugs, for microbes, and it's really due to all the new discoveries and findings that these microbes are really so beneficial for health and do so much good for our bodies. And as you know, I talk a lot about the gut microbiome, and so does Holly. But today we want to focus a little bit more on the oral microbiome because that one is really important too. Because if you think about it, the gastrointestinal tract really starts in the mouth. You know, in veterinary school, that was sort of included in the gastrointestinal tract. So in a sense, we're still talking about the gut biome then. But certainly we're going to focus a little bit more on the oral cavity and how it affects the body, what it is, etc. So I don't know, maybe we should get started with, actually, let me just see if I'm really live on Facebook, see if people are tuning in. Oh, it does look like we are live. Let me just turn it on so that I can see the comment. Yeah, so if somebody could comment or somebody's could comment. Oh yeah, it looks like, yeah, it looks like we're live. Hi, Penny. Hi, Velvet. You may want to post the link to the Facebook live stream. Yeah, well, I can't multitask. I have to admit.
Are we live on Facebook?
Yeah. Well, I mean, you know, people should know. You know, if they're Facebook Live, you just have to refresh the page until you get to see it. And if not, then you can watch it later. So, in any case, yeah, so we're talking about the microbiome. So I wanted to find out from you guys, how many of, I mean, do you guys know about the microbiome? You know, put a yes or a no in it, you know, the oral microbiome, and have you learned much about it? And then I think you had some other questions to kind of.
But I'd love to start with that. Like, I think we want to sort of get a sense of what people's awareness is about the importance of oral health, right, and how it connects to overall health and gut health. Mm-hmm. But also, of course, because we're bug lovers, so we want to talk about the oral microbiome and what people know about that.
Yeah. All right. Yes, for human health, somewhat. Yeah. Okay. All right. Well, yeah, you've been waiting impatiently, Angel. Woohoo. And Claire, no, but gut health, yes, but not oral health, oral microbiome. Okay. So why don't we, you know, talk a little bit about what the oral microbiome is to begin with?
Yeah. So I think, hi, everybody. I'm so glad to be with you all here on Sunday. So it was a Super Bowl Sunday, and you're spending time thinking about your pet's health, oral health in particular. So it's amazing. So happy to be having this conversation with you. The oral microbiome is a community of bacteria and other microorganisms that is actually really much easier to study than the gut, because we have access to it. So there's a lot of really nice research that's been done, especially on the human oral microbiome. There's like the Forsyth Institute has done tons of work there. And they've also done some work on the dog microbiome, oral microbiome. So because of that, we actually know a lot about how it becomes colonized, like in young animals and people as, right, they develop. There's a community of bacteria that accumulate in the biofilm that on the surfaces in the mouth. And there can be differences in which bacteria are found in different parts of the mouth. which is super interesting. And sometimes they've even found differences from one tooth to the next. And so there can be a lot of variation, just like we can find from like one dog to another in terms of their gut microbiome. But in this case, it can be like there's a biogeography of the mouth, and like, there's probably a biogeography of the gut, but we can't. It's harder for us to like extensively sample from different parts of it without, being very invasive.
Mhm. Yeah, yeah. And that's a really interesting aspect, especially when it comes to horses and cows and such, because they have such a long GI tract that you can't just take a poop sample and have a good microbiome representation of the entire gut. With dogs and cats, it's a little bit easier because their GI tract is shorter. But the mouth obviously is perfect because you can really go dig around into all the different areas. And so, what are the different areas of the microbiome within the mouth that have like more individual or more like unique compositions?
I mean, there's like many differences that have been found. I mean, the obvious places that differ are like, right, the tongue is different from the gingival line, which is the area between the teeth and the gums. And then like they really have, and like the cheeks are different. So when you sample in different parts, you need to be aware of where you're sampling, right? And really focus. Even like, right, with the example with horses, like there's this salivary gland, you want to like ideally sample like in that region consistently. So it can be challenging to ask the pet parent to do sampling unless you're very clear about how to do it. But what we found was that, and so veterinarians and human dentists as well will collect really individual tiny pinpoint samples from each tooth to look at the microbiome. And one thing that what we found actually that we were really excited about in the work that we did on stomatitis in cats is that when you swab across the gingiva, we actually got a really nice signal. So that's something that actually a pet parent can collect at home. It's just to swab that gum line. And that is like a more, like an easier, more general approach, but something that we're trying to make it easier because like these dental points that are the specialists use to get a tiny sample are very, you have to have special tools in order to collect those kinds of samples. And we found though, just using a nice flocked swab, we actually got similar results with a much easier sampling method.
Oh, that's good. That's good. But definitely, if you have an animal that has a lot of gingivitis and plaque and tartar, would you also kind of rub around that area, maybe a little bit more than the healthier looking areas to definitely get more of that microbial representation from that area?
Yeah, so this is a great point. So if you're doing oral microbiome testing on your pet, yeah, you don't want to just focus on the healthy area because what you're trying to do is figure out what the problem is. And so, yeah, so so you really would ideally want to focus on the area that's inflamed. And that's the thing, right? You can have a pocket in one region of the mouth and have healthy gums in the other part. And with cats and dogs, like a big issue is really periodontal disease. They don't get cavities to the same extent, like much lower extent than humans. So the big concern is really periodontal disease, and that is not a disease that's uniformly distributed in the mouth.
Mm-hmm. Yeah, yeah. Yeah, generally certain areas more than others. I mean, some dogs I see the canine teeth having more periodontal disease because they're not used as much, for example, for chewing bones, because that happens more in the back or, the front teeth as well. They may have more accumulation of plaque and then tartar. So just for those of you who don't know, plaque is basically a biofilm, which is a little bit of a mucousy, slimy layer that, covers the teeth. And when when you ate and you haven't brushed your teeth yet, you kind of go over it and you have this sort of slippery, slimy thing on your teeth. That's plaque. And plaque builds up very quickly. So even after a dental, within 24 hours, the plaque is back because, the microbes are still there. They're making the biofilm. And then when the plaque calcifies, so when minerals get built into that biofilm, then we'd call that tartar. So that's the harder stuff that you then see on the teeth that, sometimes you can pop it off with your fingernail, but at least in cats it's easier, but dogs not so much. But that's tartar. So that's kind of caked on and can hardly be removed just except for doing a real dental. So those are the differences, and that's where, the microbes sit. And depending on what microbes are there, there can be more inflammation of the gums. So I know that there are specific microbes that are, pro-inflammatory in the mouth. So when you do testing, are you able to determine just from the test results whether the animal may or may not have periodontal disease?
The way that we do our microbiome testing for oral health is that we can identify the bacteria associated with inflammation and periodontal disease.
Mhm.
And we don't make a diagnosis because we really want the veterinarian to be a part of making those assessments, but we can see a very clear signal based on the kinds of bacteria that are there. And like they're basically, so we can categorize the bacteria as being part of the healthy biofilm. And so I think one thing that I grew up with anyway and sort of the way that human oral healthcare products were marketed was sort of like my dad would do some like wash every night that had like some alcohol in it or whatever, like to kill all the bacteria in the mouth. And like, that's not actually a more microbiome friendly philosophy. I mean, so now I think we've realized, there is a community of healthy bacteria, and ideally we want to help them. And what we want to do is be more targeted in eliminating the disease associated groups. And so it's not icky and gross to have a biofilm. Like we have a biofilm throughout our GI tract, but we want to have more good actors than bad actors.
Yeah, exactly. It's about balance rather than elimination and sterilization. But I just want to get into that a little bit more in a minute. But I want to, the reason I wanted to do this oral biome, talk with you and then do some other dental care related Facebook lives in the next few weeks is because the mouth is sort of still looked at its own little compartment that is completely disconnected from the rest of the body. When we look at health, it oftentimes it's a bit of an afterthought. Oh yeah, we need to get a dental. I think it's that time of year again. And then in between that time of year, those 2 times of years, there's nothing much happening. So I want to just bring more awareness of how important it really is to help the mouth be healthy and how far-reaching the effects are from an unhealthy mouth. So if we could maybe chat about that a little bit, and if you could, give us a little information on that so that, people really understand that the mouth is extremely important,
Yeah, I mean, I think that people are just more likely to take care of their own oral health than their cat or dogs. And there's some obvious reasons why, like not all cats are probably easy to brush their teeth. And I don't know, I have to admit, I don't brush my dog's teeth. I know I should. And actually they don't really totally mind it, but it's, I work really hard and I'm tired and so I do other things. So staying on what you're going to focus on, which is oral health, right? So if you, it is not like trying to guilt people about it. It's just like, we know most of us, we're tired and we do so much for our pets and we love them and we want them to be super healthy. And what we need is really to make it easier for people to take care of their pet's oral health, right? And so it's not like extra tasks that you have to remember every day. I mean, I think a lot of us struggle to remember or take the time to floss our own teeth on a daily basis, right? Like it is something that a lot of people can neglect just because life is busy. But oral health matters. And I think we're increasingly becoming aware in human medicine that chronic inflammation in the gums can allow bacteria to get into the bloodstream, and it actually can go and create plaques in the brain. It can go into the, like, obviously it can go into the lungs. I mean, we know like very direct connections there. And so, and we have been doing work on the blood microbiome. Mostly we focused on like coming from the digestive tract, but we're finding a really strong signal of bacteria in the blood with from dogs that have inflamed guts. We can see those gut bacteria passing into the bloodstream. They're not necessarily like all active, but that doesn't, so they may be dormant when they get into the blood, but you don't really want to have like bacteria floating around in your body, right? Like they're not, or they're not supposed to be. And usually, right, if it's coming from an inflamed state, that means that they're the ones that are right, pro-inflammatory. So they're more likely to be the problematic groups that then like can interact in with the immune system in a way that's not ideal for health. And so now I think people are increasingly becoming aware that there can be links between diseases that like dementia that we hadn't really thought about being associated with like having healthy gums.
Yeah. And I mean, the heart is obviously a big one. There's always a worry that there could be bacteria that then migrate into the heart and then sit on the valves and cause damage to the valves. Arthritis, autoimmune diseases in humans. I don't think there's as much research, obviously, in the field of the animals, but we also know that an animal that has chronic kidney failure and a horrible mouth, a lot of dental disease there, that will significantly affect the health of the kidneys because they certainly don't like to be bombarded with microbes, and also the inflammatory component, because the microbiome in the mouth can also, cause a lot of inflammation, and then it can perpetuate that inflammation and just keep it going. And the body does not like chronic inflammation. It kind of gets destroyed in the process. So it's far reaching. And I found an image, because we always talk about the gut brain axis, the gut whatever axis, right? But I found one that talks about the oral metabolism axis, which can affect aging and longevity. The oral vascular axis, especially in humans, even more so because they have found that when they're not the right types of microbes in the mouth, then nitrite, I can't remember which, but there's some issue that then affects blood pressure, because there's not enough of certain substances being processed by these microbes. And then there's an oral brain axis, an oral gut axis. They found that it actually goes both ways, not just gut oral, but also oral gut, and oral blood axis. So the mouth is just as important as the gut. And I think, in my opinion, it's even more important than the gut for it to be really healthy, because that's where it starts. And I guess my question would be to you, are you finding that a lot of these microbes that are in the mouth, the more pathogenic ones, also can be found in the gut microbiome then, or what's the research on that?
Yeah, I mean, so what I'm finding with our research is actually more kind of the other direction. I mean, so there could, we're not typically finding in a fecal sample a lot of oral bacteria, probably because there's a lot of bacteria in fecal samples, right? So that signal is probably like dampened quite a lot by all these other things. But the thing that I'm finding that is really unusual is because so many of our customers have a cat or dog with a chronic gastrointestinal condition, and so and that the ones that are having like upper GI and gastric reflux, we're seeing a signal of bacteria from the GI tract actually colonizing the oral cavity. And so like anaerobic gut bacteria some of them are pathogenic in the mouth, because right, you don't a healthy oral biofilm should be more aerobic bacteria. Those are like oxygen loving bacteria. And it's like when those pockets form, you get little communities where bacteria that don't really like oxygen can live. And those tend to be the ones that are pro-inflammatory, and they cause bad breath. They get involved in, right, these nitrogen and sulfur cycles that, like, you were talking about, that can become problematic for health. And so, and the other thing that's really weird that we've been finding, but now I'm starting to see support in literature, is in some cases we're finding E. coli colonizing the mouth. But if you talk to, like, most veterinarians, they're like, well, dogs eat poop, so, like, that, and, like, poop has E. coli, right? But what we're finding is that the E. coli is actually colonizing the oral biofilm, like, and right, we know that it's pro-inflammatory and that you don't really want it colonizing there.
Yeah, yeah. So then, in a way, you have to kind of start at the mouth level to decrease the levels, and then also do the same for the gut. Probably, I would do it at the same time, because you don't want to have it go back and forth. But taking care of the mouth that way is really important, so that the inflammation can be reduced, because inflammation also causes a bit of a parasympathetic decrease, so they don't heal as well. They're not relaxed as much, and that affects how the gut works as well. So if they're more in like a fight or flight because there's constant inflammation going on, that will weaken gut health. And I don't want to share too much, but I recently had some dental work done to really clean out my mouth. And since I've done that, I feel like I'm digesting my food better. And it's not that I'm chewing more or anything like that, but I'm not so tired afterwards. And I wonder if previously, because I still had some things in my mouth that weren't supposed to be there, that every time I was chewing, I was releasing a bunch of pro-inflammatory chemicals that then would affect how my digestion was working. So that's just one little thing that I kind of have observed. It's only been 3 weeks, so there's probably more to come. But I have found, just in my experience and also with my patients, that if you don't take care of the mouth, nothing else can work, including the gut
Yeah,
cannot work.
basically, like, you'll have little factories going on where they're producing these compounds, and they're also, like, producing bacteria that can go and colonize in other parts of the digestive tract, and you want to reduce them and not have, like, promote them, which is so. And I think with the E. coli too, that it's probably colonizing, like, the esophagus and other areas as well, but we aren't able to sample that very easily.
Yeah, yeah. Well, and especially with diseased teeth, when they're like abscesses, at the tooth root, or even just inflammation deep in. I mean, these microbes, they continuously produce chemicals that are toxic to the body, and they're kind of spread around. And it's like the body is living in like a toxic cesspool as a result. Obviously we have all the toxins that are that we're exposed to in general, but then we also have like little toxic factories, and especially if they're like gum pockets, where you can almost stick your finger in it all the way up to the roof. I mean, those little pockets have to be taken care of, and if you don't take care of them and clean them out and all of that, and remove the teeth that are diseased, then you just have this constant chemical factory that's sitting there and causing damage, and the body cannot recover from that. I mean, they found that in people with root canal teeth and others. It just affects the immune system so much that and the rest of the body in general, that it's hard to be healthy that way.
I'm really interested in the fact that I think a lot of people don't want to think about oral health, and I think some of it might relate to the fact that, like, I don't know about you, but my dentist growing up was kind of judgy and made
Yeah.
me feel bad. And so then you're like, I don't really want to, like, it's stressful. And so some people have a lot of anxiety about going to the dentist, and I'm sure that might influence how they handle their pets' oral health too.
Yeah, and especially because for humans, generally you don't need anesthesia unless you have like you're terrified or something. But for animals, without doing anesthesia, we cannot really look at the mouth thoroughly. And you and I talked briefly about anesthesia-free dentistry. there's no way you can do a good job with anesthesia-free dentistry. And in fact, I've seen quite a number of animals who had years of anesthesia-free dentistry, and the teeth looked okay. But then once they actually went in for a real dental with anesthesia, where they took dental x-rays and everything, they had a massive amount of teeth that needed to be removed because they were all diseased. And you can't see any of that if they're not under anesthesia, because you cannot put a x-ray plate in the mouth without them being asleep, because otherwise they chew on it and then it breaks, and they're not cheap. So in any case, they also have to hold still, obviously, otherwise you just have a blurry image. But in any case, anesthesia-free dentals are, in my opinion, a complete waste of money and can prolong suffering significantly and decrease the health and lifespan of an animal as a result.
Yeah, but I think people think that like it's less stressful on the animal, but I know I have friends who like they brush their dog's teeth every day and they would do those anesthesia-free cleanings, and then they had just the experience you described of like when they got a real dental, there was all this disease and they had to have many teeth extracted. So there's really no replacement for having that veterinary examination and cleaning.
Yeah, no, it has to be done right, but definitely brushing teeth in between and doing some oral care is very useful, because you break up the biofilm and you prevent calcification of that biofilm, which then turns into plaque, which then you can't get off without doing a dental. So it certainly maintains in between. And it also depends a little bit on the animals. Some animals, especially the smaller breeds, they tend to have crowding because the head doesn't shrink at the same rate as the teeth. Well, or I should say the teeth don't shrink at the same rate as the skull. So they end up having teeth that are too big in the mouth, and then there's crowding. Hi, Carlton.
I'm getting coffee delivered.
Ah, nice.
Like,
Oh, that's Holly's husband. Anyways, yeah, so I guess my question to you, Holly, is do you see a difference in the oral microbiome of smaller dogs versus bigger dogs? Do you see a difference in the
I
biome?
do, and I'm more likely to find oral pathogens there. And I think it's because of what you said, like because of the crowding. Also, though, in addition, a lot of smaller dogs are less likely to drink water.
Mhm.
And so I do think that like that matters, especially if you're using like something like a water additive for oral health. It's not going to, I'm like, I think those are really important tools,
Mhm.
but you need to know that it won't work quite as well because if they can't drink as much water.
Yeah, yeah, yeah. And they also are less likely to chew on a bone. I mean, some of those smaller dogs, they're like, yeah, no, I'm not chewing on that. I'm beyond that, I'm like civilized now.
And they're like little people. They're like, I'm not a dog.
Oh, I know, right? But the other thing too that may affect oral health that I'm just thinking about in small animals, smaller breeds than larger breeds, is the immune system and how we use immunizations early on in life. I'm going to stick with that name, but because somebody told me that their YouTube video was taken down because they used that word that nobody should speak of. So in any case, immunizations, they
Sorry.
can also affect the protein in the body in general. So a study that had found that those that were immunized, they had antibodies to certain proteins, including collagen. And the periodontal ligament, which is basically a ligament that attaches the tooth to the bone, is made of collagen. And since small animals get the same amount of immunization as a large dog, I'm just wondering if they have a much more significant immune reaction because they're just smaller, and that also influences the integrity of the soft tissue around the tooth, which then would kind of open up the space for microbes to just sort of move in and find their new home.
Yeah, I don't think I've seen any research on that. It's a really interesting idea. probably need something that should be looked into.
Yeah, yeah, so many things that should be looked at. And then I think I want to move on into treatment a little bit. So when I did some research in the last few days on humans, I found some information saying that the microbiome in the mouth is much more stable and more resilient than the microbiome of the gut. So meaning that if you do something to the microbiome of the mouth, it's going to recover much more quickly or be less affected than if, for example, you've given antibiotic. Gut health, the gut microbiome is more sensitive to that. In particular, there was one study I found on clindamycin, and they found that the gut microbiome did not recover all that well from that, but the oral microbiome within 4 weeks was back to what it was before.
Yeah, I mean, it makes sense because a lot of the mechanisms for the antibiotics are most harmful for anaerobic bacteria. And fortunately for the mouth, like the bad actors tend to be anaerobic.
Mm-hmm.
But in the gut, those anaerobic bacteria are performing, I mean, there can be different species, but they're performing critical functions. You want anaerobes in the gut. You don't want them in the mouth. And so it makes sense that you would see that signal that, right, you're killing off the bad things. So you're going to have more recolonization
Mm-hmm.
in the oral biofilm of the aerobic bacteria that were not killed by antibiotic exposure.
Yeah, yeah. So when you see an imbalanced microbiome, what of the mouth, what are the recommendations that you guys have, and what do you know about the different type of treatment that's available?
Yeah, I mean, of course, the first thing is like I view that sort of oral microbiome testing as a way of raising awareness of the essential roles that oral health plays in overall health. And I don't want to replace like the role of the veterinarian, like having the veterinarian do the examination and do the cleaning is like something we can't replace. But when we see representation of a lot of these groups of bacteria that are associated with periodontal disease, we see a really clear signal. We also now know, like we have published work on this feline chronic gingivostomatitis in cats as well, right? And that can happen in dogs to a lesser extent, a little bit different organisms involved, but typically we do recommend toothbrushing, right? But we recommend making sure that you keep your veterinarian involved. And then like there are daily things that you can do, right? Like using a water additive to support the healthy oral biofilm can be a useful tool, especially I think in dogs that drink more water. It works well for my dogs, but I think some of these smaller dogs may not be as effective. So in that case, usually like you maybe need to make it more concentrated for those small ones.
Mm-hmm.
But there's really no replacement for the toothbrushing and the dentals.
Mm-hmm.
One thing though that I am a big fan of is there's Icelandic kelp. So has been shown to help reduce plaque in dogs. And so I created a product that has Icelandic kelp, and then I added in this bacteriophage cocktail that's targeting E. coli. And I think this is really important because it's really the problems with E. coli are really underappreciated in general, I think, in veterinary medicine, not just in the oral cavity, but also in the gut. I think because there's sort of this prevailing wisdom that like coliform bacteria are in poop and like it's normal, but and low levels of E. coli in the gut are normal. But high levels, which we find in a lot of these GI cases, is not, and it's pro-inflammatory and really problematic and associated with dysbiosis. And then in the oral cavity, actually, there was a paper that recently came out that showed that dogs with oral tumors had E. coli associated with those tumors, and the healthy dogs didn't have any E. coli. So I think we're going to find. I know there are other bad actors, but I'm really sort of on this E. coli kick because we're finding that it's a real problem that's like very obvious and important to address. And these bacteriophages that I mentioned are targeting E. coli. We're working on optimizing it even more so that we can do an even better job because there's a lot of different strains of E. coli. But you definitely, want to make sure that if you find pathogens in the oral cavity, that you do something about it.
Mm-hmm. Yeah, yeah. Yeah, and just to mention, not all E. coli are bad. There are a lot of them that are good as well, but there are definitely some that are not ideal to
Well,
have.
there's a lot of them,
Or non-pathogenic,
but in the oral cavity, I think the fact that they're there means that they're pathogenic, because they shouldn't be able to colonize the oral biofilm.
Yeah, yeah. So how many, percentage-wise, how many dogs or cats that you do the oral microbiome testing on, do you find have E. coli? I know in dogs and if for the gut, it's like 1 in 4 and 1 in 3, I believe, right?
I don't have the number offhand, so I'll have to get back to you, Odette.
Yeah, but is it more common than uncommon? I mean, are you seeing it on a regular basis?
I do see it on a regular basis. I mean, if I had to guess, I think it's probably something like 1 in 4, or maybe it's 1 in 5.
Mhm.
So typically people who submit samples are submitting samples for like older animals that are having other conditions, or like that are, right? So if you do a young, healthy cat or dog, we don't expect to find it. And I think it's really also, my suspicion is that it's associated with having a chronic GI condition, and that these more pathogenic groups of E. coli have been promoted by the use of antibiotics in the gut and are part of dysbiosis. So like we know that like E. coli, streptococcus, some of these bad groups come up after antibiotic exposure in the gut, and good groups like Hirnonis are eradicated because they're super sensitive to antibiotics. And I think for those animals that have like gastric reflux, I think the acid and the reintroduction of E. coli into the oral cavity is allowing them to colonize.
Yeah, yeah. Because I know there's been some research done in the human field as well regarding the pH in the mouth. Um, do you know of any research that was done on that for animals, dogs and cats, by any chance?
I am not in there, what may have been, but I'm not aware of it.
Yeah, yeah. Well, in any case, for humans, what they found is that with a really low pH, there are certain microbes that then overgrow, and more of the pathogenic types will grow better in a low pH, and a low pH can be created with sugar intake, for example. And so similarly, I mean, obviously without knowing any of the research that's been done, we can't really say that it's the same thing for animals, but those that are on a high carbohydrate diet tend to have teeth that are in worse of a shape than those that are on a raw diet. Whether it is because it's affecting the pH in the mouth or not, who knows? Because dogs, especially, they gulp, they don't really chew things. So the food doesn't really actually stay in the mouth all that long. Whereas when I eat a piece of chocolate, I try to savor it and swish it around and really smear it everywhere. So it may be a little bit different that way.
Yeah, it's part of the challenge. So one of the things you're alluding to is like if like the higher carbohydrate food is getting stuck in the mouth, right? Then it's going to have a much bigger effect than if it's just getting wolfed down, like one of my dogs does, just inhales this.
Yeah.
But yeah, and so it's hard to know, like, is it that like the raw foods are higher protein? Probably that's part of it. But also there's like mechanical differences, right? With sort of from a kibble to a fresh meat based food that would affect like accumulation of particles in the mouth.
Yeah, yeah, because moist meat tends to just kind of go down easily, whereas dry food just gets kind of caked on to the teeth, contrary to popular myth that kibble helps to clean teeth. That's really not the case.
Yeah, unless they put things into the kibble that are, designed to do that, which there are some products like that. So it's, not everything's the same, but yeah, in general.
Yeah, yeah. Yeah. So, I want to go a little bit more into treatment as well, but talk a little bit about that study that you did on the gingivostomatitis, which is a very painful condition in cats where the gingiva and well, some studies or some veterinarians also say that the bones are affected, that it's really a bone disease, not a gum disease. But in any case, it's a very painful condition for cats. So yeah, tell us a little bit about that study that you guys just did recently on
Yeah,
that.
we're very proud. We got a grant from the Foundation for Veterinary Dentistry to look into the oral microbiomes of cats that had this terrible condition. And I don't know, Dad, if you want to sort of mention that what the standard treatment has been is that they typically do full extractions of all of the teeth, and that actually seems to work. But that, of course, that's kind of extreme and not really what anybody wants to be the treatment. But that's
Also not 100% successful. I mean, there's still a lot of them that don't actually get better from it.
yeah, but it does, like, I know people where it did work, so sometimes it does, and so that's kind of the only thing they have at this point. So the aim of this grant is to look at how basically to describe the biogeography or the differences of in the communities of bacteria in different parts of the mouth in cats with this condition, and then with healthy cats. And then we also looked at cats that had periodontal disease, because it's messy. Like, some of them have stomatitis and periodontal disease. So we had to like sort of have all of these groups because it's complicated. If you have, and then I don't know if you want to describe like tooth resorption and like that. Anyway, so there's some of them actually like have things like tooth resorption. So we had to get samples from that and sort of make sure that we could say like, oh, this is because of stomatitis versus some other oral health problem.
Mhm.
And what we found is that the cats with FCGS, or feline chronic gingivostomatitis, had different groups of bacteria that were more prevalent. They had lower numbers of different kinds of bacteria and then healthy cats. And so this is sort of a first step. And then really what we're looking towards is like, what can we do to create more microbiome friendly solutions so that we can hopefully replace tooth extraction as the sort of standard of care.
Mhm. Yeah, because it's a pretty bad condition, and from what I read, up to 12% of cats can actually have that feline chronic gingivostomatitis syndrome, and that's really hard. I mean, that puts a lot of strain on their lives, obviously, because they're in constant pain. I also did read a couple of articles this morning on that for alternative ways of treating, and there was one case study of a cat treated with a homeopathic remedy, and then another cat was treated with acupuncture and diet modification, and they actually both resolved relatively quickly. So I'm like, yay. So there are certainly more things, and there's also been some study done with stem cell therapy at UC Davis. They did a study on that and had some success as well. And then another guy who is doing some relatively invasive procedure of cleaning out the bone, the affected bone. But yeah, that sounded very invasive to me, as far as also needing a stomach, like a feeding tube for that time so that they would still eat and such, prior and after the surgery. So anyways, if there are easier ways, especially of manipulating the microbiome, that certainly would be a good thing. So what are your thoughts on, there are like let's just say there are a gazillion different mouth supporting agents, mouthwashes, toothpaste, everything from natural to unnatural and such. So what is your take as far as the potential effect that these products could have on the microbiome of the mouth?
Well, I think I mentioned the Icelandic kelp, because it has been shown to reduce plaque, and I think it's more mechanical in its mechanism. It's able to sort of, I think, coat the teeth and maybe and get in there, and but not, of course, not the same as the cleaning. The big thing that people complain about is really smelly breath, like dog breath. And what I found with using the kelp, and especially in conjunction with these phages for E. coli, is that it really works on doggy breath. And that's something that, like, you can appreciate on a daily basis. And you see that with other products, right? Like that's one measure of like, if the chew you're using, the water additive, the kelp is usually added as a topper to the food. If you start to see an improvement in their breath, that's a good sign. It's obviously like not the same as having a veterinary exam, but it's something that, I don't know about you, but my dogs like to sit right next to me in the car and breathe on my shoulder. And so it's nice to have their breath be better.
Right. Because you can't really tell them, hey, go brush your teeth. Yeah.
I do totally agree with the toothbrushing. That's the gold standard. And really, it's hard to improve on that. Where we're going with the work that we're doing for the cats, and then also we have a project for dogs, is to like create more sort of these bacteriophages that are going to kill the bacteria associated with the disease process in a targeted fashion. So they're not going to harm like the gut anaerobes, right? Because it's hard if you can't really deliver antibiotics. I mean, they have like sort of things that can go on the gum lines and stuff, but like, it's hard to have it not get swallowed and go into the gut, right? And have some residual effect there. The other thing we're looking at is fungi and the role. We think that fungi are playing a role with stomatitis, and so that's currently what we're doing, is analyzing the fungal communities in this set of samples that we got from like that were clinically validated. Very excited to have this data set, and then consider if antifungals might be a possible solution for the stomatitis issue in particular. And then we have another grant from the same foundation to look at oral tumors in dogs. And right now, the number one association that we found, but it's very early, we're still collecting samples, but is this E. coli connection, which is surprising and interesting.
Yeah, because usually it's more Porphyromonas gingivalis and some streptococcus and some other nice. They all have. I don't know how all these weird names come about. I'm like, they're like tongue twisters. But yeah, what was I going to ask? When you do the sample collecting, do you also collect data on what somebody may be using as far as dental care products at the same time, just to kind of see how each would affect, the mouth, the oral biome?
So when we have sort of our citizen science data collection, which is when people like come to us and submit and like send in a sample for oral microbiome testing, we are asking them those questions there. And we will use the data in research to try and create better products for these problems. When we're doing these studies with a specialist in veterinary dentistry, I think you can imagine the veterinarians are really busy. And so we get the core information, but we do not get the information of what the owner is actually doing to support health the same way, because they're just too busy to do that part of the research for us. And so that's I would say one challenge is like, so we're really excited to have clinically validated samples collected by veterinarians, but the veterinarians don't want to ask 250 questions of the owners.
Yeah. Because I think that would be a very interesting study, because we all grew up with, you need to use mouthwash and you need to use toothpaste, right? So that sort of has translated into animals just as much. And I see it, what kind of toothpaste can I use? What to use to brush teeth? But the thing is that a lot of these about water additives, and I know you were talking about a different one, and we can certainly mention that one, the TEEF, which has a different function. So I don't want to put that into the same category as the other water additives, but a lot of them have either chemicals in them, like not chlorhexidine, which basically just kills everything. It's basically a disinfectant. But a lot of them will also have essential oils in them. And a lot of these essential oils have antimicrobial properties. So if you have an animal that has a healthy microbiome, I would recommend not using any of those. But if you are working if there is a problem and you need to reduce certain microbes in the mouth, then maybe that's a good idea. But it can also be reduced in a different way, and we'll talk about that, because anything that kills, be it colloidal silver, peppermint oil, lavender oil, clove oil, all of these things have antimicrobial properties, and it doesn't just kill the bad players or the bad actors is what you call them. It can also potentially affect the good ones. And so I'm usually staying away from that. And I just recommend, when you're brushing teeth, just, dunk it in a little bit of bone broth, because they're going to love that probably because it tastes good. And then just brush, it's the brushing that really breaks down the biofilm and gets rid of some of these microbes in there, mechanically, where you're not just decimating certain species in there. So personally, I don't use toothpaste for myself, and I definitely don't use mouthwash because that stuff is disgusting. But yeah, I haven't used toothpaste in like forever.
I like mechanically like brushing, and also that's why I think the kelp is good. It's just mechanically trying to reduce the plaque levels and keep the biofilm from like starting to accumulate some of these problematic groups or bad actors.
Yeah.
And that's why I like bacteriophages, if they're targeting specific pathogens, that's much better than something that has a general antimicrobial effect can be a problem, especially if you already have a dysbiotic pet. Like adding more antimicrobials isn't gonna be good for them.
Right. So yeah, so just for me, it's like I'm categorically more into just letting nature do its thing and just assist it with brushing and clean food, clean diet, anti-inflammatory diet, because whatever an animal eats also gets reflected in however the mouth ends up looking. But again, small breeds are definitely much more of a challenge, even if you're feeding them a healthy diet and such. They have more issues that way. But maybe you want to maybe mention teeth, because it does function very differently than any other water additive that I'm aware of.
Yeah, I mean, teeth basically it is a powder that goes into water, and the idea is that it's trying to basically support the healthy bacteria in the oral biofilm and starve the ones that are bad. And so the bacteria associated with periodontal disease have to scavenge for certain things in the mouth, and if you block that, then they have trouble growing. And so this is one approach. There are probably other products that like are common. Some of the ingredients are used in human products it's sort of, there's a lot known about the use of iron by a lot of these bacteria that are problematic. They like blood. So so that whole like gum disease thing becomes sort of a cycle. And so anything that you can do to try and like reduce those groups of bacteria is beneficial. And I think the challenges with I use teeth for my dogs. There are some challenges in it. Like I change their water bowl every day, right? So that means that I'm replacing it quite frequently, and so that can make it expensive. But I've just made the decision that oral health is really important to my dogs, and I'm just willing to do it and maybe it's in part because I'm not brushing their teeth every day. So, but I'm willing to like give them clean water and put this additive in, then I can tell the difference. I also do our oral cleanse and put the isonic help with the Pre4 Pro on their food as well. And I sort of do this combination of both.
Yeah, but I mean, just to let everyone know here, your dogs are not exactly small either. So they probably already have better teeth just to begin, a healthier mouth to begin with because of their size.
Well, and I mean, that's right. I have medium-sized dogs, but Charlie's 16, so and Darwin's 13, and I would say their teeth aren't, as great as I would like them to be, and so we're going to be getting them in for dentals because, and my veterinarian has been really conservative about doing them because of her concerns about anesthesia, and I didn't know if you wanted to sort of talk at all about that just briefly.
Yeah, I mean, I know there's a lot of fear going around, and I'm not saying that anesthesia is always is not a cannot be a risk, but the risk is not nearly as high as people think it is. There was a study that was done in out of England, I believe, and I can't remember how many dogs that were under anesthesia that they looked at. I think it was definitely a lot. I can't remember the exact number, but the risk was 0.014 or something percent. So very, very low risk. And those that died didn't even die under anesthesia. Some of them died afterwards for whatever reason. I'd have to go back to the study, but the risk is not nearly as high as previously thought. And I do want to see if I can get an anesthesiologist to come and chat with all of us here and talk a little bit about it. Also to give everyone a little bit more information on what to ask for when you're talking to your vet about doing dentals and such, so that you can be better prepared and you can better evaluate whether this is the dentist or the veterinarian that you want to have do the dental on your animals.
And I know we're almost at time, but this is Pet Dental Health Month. And so I think it's a good time to talk to your veterinarian about it. And I know it's expensive. I mean, that's the other thing, right? To do a dental today, I think the costs have gone up a lot, at least where I live.
Yeah, but again, on the other hand, it's so worth it. And I will share more about my story about, dental care. And it wasn't exactly cheap either, but the benefit from it is like, you can't pay for that. I mean, it's just so amazing. So I want that for all of your animals as well, because I know you all love your animals so much and you care so much about them. And some will let you brush their teeth, and others are like, nope, I'm going to chew off your hand if you try that. But there are so many things that we can do to help them as well. Somebody mentioned earlier about 1-TDC, which is a fatty acid that can be used. It's an anti-inflammatory. It can be, smeared on the teeth. It will help decrease inflammation. So that's definitely good. Then teeth is a very easy one. Doesn't taste like much. It's really kind of like water. And if you have a dog that doesn't drink much, you could just, pull it up into a syringe and just do a little mouthwash with that after they're done eating. And that way it'll stay in the mouth as well and do its thing. So there are, many ways, and we'll talk more about that. I have Dr. Katie Kangas who's going to come on. She's very good with dental health as well, knows a lot. And then I'm going to see if I can get an anesthesiologist to come talk, and then also a dentist, a veterinary dental specialist, hopefully. And then lastly, I will have my own dentist who is in New York, and he's kind of the father of biologic dentistry. So I'm gonna kind of rope him in as well to come and talk. And so it'll be a little bit of an extended dental pet health month because I couldn't quite get my act together and everybody in line. So, but that's all right, right? Because dental care should be done all year round and shouldn't just be limited to 1 month just because it's a little cheaper, although that obviously certainly helps. Certainly helps.
I just wanted to sort of plug that Animal Biome does oral microbiome testing, something you can do in home. And our oral cleanse product, which people are still becoming aware of, I use it on my dogs and find it really works. And all my friends I recommended it to have had the same. It's just putting this kelp powder but it's unique because it has bacteriophages for E. coli.
Yeah. And again, with small dogs, it's a little hard. They tend to continue to lose teeth just because of, the way they're built, their mouth is built. It's just too much crowding, not enough bone, too much, space for inflammation and such. And, dogs can live without teeth. Cats can live without teeth as well. So I'd rather take a tooth out than leave it in and be a problem. For the body, it's better to remove whatever is in there, because something, if it's a tooth that died, or like a root canal tooth, for example, it's a dead thing that's sitting in there, and the body does not like dead things in it. It just wants to get rid of those. So um, it's not the worst thing in the world, because again, I have seen dogs have more than 20 teeth removed, and they do fantastic afterwards. I mean, they revive because they've been in pain for so long that and you can't tell that they're in pain because they're good at hiding it. They will still eat, they will they will still behave normally. You don't notice the difference until you take the teeth out that were hurting, and then you're like, oh my God, I'm feeling good now, and jumping around. I mean, I've had so many dogs that were like puppies again after they had a good dental. So um, it's good to get rid of what hurts. We don't want them to be in pain for a long time.
So important.
Yeah, and I also highly recommend looking at the teeth at least once a week. Daily would be better, because they can break teeth. They can run into things, and then all of a sudden they have a broken tooth or something, and those are painful. So if you can find it sooner than later, that they will definitely thank you for that as well. And then, do you have one more minute, Holly, or do you have to leave?
I'm gonna need to go soon.
Okay, well, there's one question about teeth causing digestive issues in dogs. Have you heard of any? And teeth
Well,
spelled TEF as in Frank, for those of you who aren't familiar with it. Teeth and then exclamation mark. That's the brand name.
so I haven't had a lot of complaints about people having that problem, but if you have a cat or dog with sensitive stomach or digestive tract, yeah, there can be all kinds of things that trigger things. So it's not common, but I believe it happens, and you should just not use it if they're sensitive to it.
Mm-hmm. Yeah, and then fix the microbiome of the gut so that then you can use it again, because the microbiome of the gut is fixed. So
I mean, that is a sign that you need to work on restoring the gut. And
yeah.
I do find that the sort of the oral cleanse powder works just as well, and then it's an alternative, and it actually
Mm-hmm.
has omega-3s in it because it's
Mm-hmm. Yeah. Yeah.
so there's other benefits. So there are alternatives, but
Mm-hmm.
you make a very good point. Like,
Mm-hmm.
and I think they probably already know that they're living with a pet with a chronic enteropathy, that they have to work on that.
Mm-hmm. Yeah. 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 So thank you so much, Holly, for being here today. And for anyone out there who wants to do some microbiome testing of the oral cavity, I highly recommend doing that. It's a really good preventative tool, and also a helpful tool if there are issues, to make sure that you can have an animal that has a long and happy life. So animal biome is I think you're the only ones who are doing the oral biome in this country anyway, right?
For cats and dogs.
Yeah, yeah, not for humans,
Human,
obviously.
yeah.
Yeah. Yeah. And yeah, if you need any help to work on the whole GI tract, I'm always here as well, and that includes the mouth. I do have like my free masterclass on my website, odettsuderdvm.com, that you can check out. And I have a whole program where we talk a lot about dental care as well, because it's part of overall health. How to prepare them, how to make it smooth, how to help them recover better, etc. So there are a lot of tools, and then obviously animal biome. You have a lot of articles as well on your website and such. And then we'll be talking again. So for
Yeah,
any.
we both want to empower you guys to, take the best care you can of your pets. And we know that you work to do that every day. And I'm so grateful to be a part of this amazing community.
Yeah.
And I also think veterinarians are really special because, unlike human medicine, you learn about, well, one, they're really special because they love animals and they want to help them. And, and that is usually the primary thing for veterinarians, right? Like as opposed to some other specialties. But it's also special because you learn about the role of oral health in overall health, whereas like in human medicine, dentistry is separated out.
Mm-hmm. Right. Right. But there is a bit of a more of a coming together happening in the human field as well. I mean, not that dentists are necessarily becoming MDs and vice versa, but the working together. And I mean, there is a little bit of separating happening in the veterinary field as well, with having veterinary dental specialists as well. So that's good. But still, you know, a lot of veterinarians generally look into their animals' patient's mouth.
When you get training in
Mhm.
in oral health too, which
Yeah.
is more unique. But it's true, we're actually finding like with the work we're doing with oral microbiomes in cats and dogs that like actually some of our work's being presented at dentistry conferences that are for veterinarians and human
Oh,
doctors.
nice, nice. Yeah.
Yeah.
Yeah, that's good. That's good. Yeah, you guys are doing important work, and I so appreciate that. You know, you're looking at, yeah, you're kind of opening up like a whole new field of treatment and approach of looking at things and such. So it's you know, I really appreciate all that you do.
Thank you. Well, I feel like I have my dream job. So
Yes. That's good. All right. Well, everyone, it was so good to be with all of you. Thank you so much for being here, for listening in, and for learning for your animals, and you know, improving upon their care even more if you aren't already doing all of these things that we're talking about. I mean, there's always more to go. We know that. And thank you again so much, Holly, for taking time out of your Sunday early morning. Thank God you had coffee delivery, right?
yes, I have a good husband. Thank
Yeah,
you.
yes, you do.
It's great to see you.
Yeah, good to see you all. All right. Bye, everyone. Have a nice Sunday.